Hey guys, welcome back to my channel. It's Jessica Ward King, the StigmaCrusher here. So as you'll notice, I have a new background. This one's a movable background, so I'm going to be trying out a few different places for lighting and places for where to put this background. So let me know what you think of it and what you think of the new lighting style. And as promised, I did get my mental health tattoo last week, but they didn't get to finish it. I was so disappointed. So I got all of the black outline and the black and gray shading, but none of the color. I'll show you anyways. So here's what it looks like. Oh no. There it is. So I've got the brain, and on this side we've got the three molecules: dopamine, norepinephrine, and serotonin. We've got pills to obviously indicate my medications, and a little zap for all of my electrotherapies. And then this side is going to be all rainbow colors spilling out of the brain. And of course, the symbolism there is multiple, as it usually is, indicating my bipolar disorder and all of the therapies that I've tried to try to alleviate some of the distress I get from the bipolar disorder. So look forward to seeing it completely finished in a month or so. But today, that is not what I'm talking about. Today, I want to talk about, so I've talked a lot on this channel about medications and the different side effects and things that can happen with psychiatric medications. But usually I talk about the more typical reactions that can happen. And today I want to talk about some of the more atypical and more serious and severe side effects that one can get from different psychiatric medications. And today's video was inspired by a new medication I'm taking. So it's lamotrigine or Lamictal. And one of the things they always tell you when you start lamotrigine, first of all, you have to start with a very small dose. So I started out with 25 milligrams every other day, working up to 25 milligrams every day after 2 weeks. And then for 2 weeks, it'll be 50 milligrams every day, and so on and so forth until you get up to a therapeutic dose, which is actually in the hundreds of milligrams. So it's a very, very slow titration. And the reason for this is Stevens-Johnson syndrome, or SJS. And it is a very, very serious life-threatening condition that can happen when you start or change doses or end therapy with a variety of medications. But one of the most famous of these is lamotrigine or Lamictal. And so when I started it, everybody and their dog was asking me, have you seen a rash? Did you see a rash? I changed dosage. Is there any rash? Have you seen a rash? And really the risk of having Stevens-Johnson syndrome in response to lamotrigine is about 0.04%, or 1 in every 2,500 patients that receive lamotrigine. So that's a fairly small percentage of people. The reason it's so frightening is that it is fatal in anywhere from 10 to 30% of cases, and it causes significant disability in many, many more of those. So this disorder looks like, it starts out with kind of flu-like symptoms, a fever, maybe sores in and around the mouth, in the eyes. It really is, it's a disorder of the skin and mucous membranes. And so you'll start to see a purplish rash that usually starts on the chest or neck or face and will spread to the rest of the body. And this rash will very quickly turn into blisters, and then the skin will itself, this is graphic, people, the skin will itself die and fall off. So it's kind of necrotizing the skin. It's not a skin-eating bacteria. It's not a flesh-eating virus or bacteria, but it's a disease that causes the skin, the top layers of the skin to die and to fall off. And there's serious complications with regards to, obviously, infection. Usually patients that have Stevens-Johnson syndrome are either treated in a burn ward or in an intensive care unit. And at the first sign of any rash while you're taking lamotrigine, you are instructed to go straight to the emergency room. You don't wait to see your doctor Monday morning. You don't call your psychiatrist and leave a message. You go straight to the emergency room. And if it's not Stevens-Johnson syndrome and it's just a rash from something you ate, great, you're lucky. But if it is, the quicker they can get it taken care of, the better your chances are for survival and to have less disability. And it can be, you can get lesser cases of it. Like not every single one results in all of your skin falling off your body, but it's a very serious risk. And so that got me thinking to what if any, are the serious risks of the other types of psychiatric medication? And as I started thinking about this and kind of looking at my list, I was like, oh dear, there are serious complications and serious side effects to pretty much every psychiatric medication, all the ones I've been on certainly, and all the ones I could think of. Now, this isn't altogether shocking because of the way in which we classify what is a potential side effect or complication of a medication. So here in the West, in North America particularly, this is governed by when they do clinical trials, and then when they release a medication for public consumption, there's like a hotline that you can call if you have any side effects, or doctors that notice any side effects. And if that gets over certain thresholds, then it's kind of known to be related to that medication. Also, the clinical trials that they do. So if a certain number more of people that are taking the medication get said side effect than do the people in the placebo control situation, then it's said to be a potential side effect of that medication, which is why pretty much every medication has like headache and stomach ache as a potential side effect, because people just get headaches and stomach aches when they're in the clinical trials. But there are some serious ones that are known to affect a lot of the different psychiatric medications. So let's get into it. So some of the earliest medications, psychiatric medications to be made, were the benzodiazepines, or anti-anxiety medication. And they received a lot of fanfare, particularly in the 1950s, 1960s, because they were being prescribed for a lot of housewives, if you will. And that was to allay any anxiety they might have. It was really trendy for a certain subset of people to be taking Valium, Xanax, those kinds of things, just to help them get through their day, to help allay anxiety, and to reduce fear. Now, the only backlash came when they realized the incredible addiction potential of benzodiazepines. They are a hugely useful, powerful, amazing medication for those that are struggling with anxiety, particularly not generalized anxiety, not ongoing like obsessive compulsive anxiety, or even necessarily things like PTSD that are really long, drawn out, ongoing periods of anxiety, but rather shorter bursts. So to be able to treat a panic attack, for example, or to be able to treat a specific phobia. They can be taken in small doses for short periods of time, relatively safely. But as I say, they have incredible addiction potential. And addiction is it's another mental illness, and is very serious and can be a lifelong disability. And becoming addicted to benzodiazepines, it can become somewhat of a gateway drug. So benzodiazepines being a legal prescription drug that you can maybe get from your family doctor, and then maybe from a clinic, and then maybe from the hospital. And then if you start to run into walls, you can't get them anymore. There are street medications, or street drugs rather, that can give you somewhat the same effect. And so you can go from having a legitimate prescription for a medical necessity to being in a situation of addiction where that addiction becomes a medical necessity, but you're seeking those that chemical substance elsewhere. And so that can be very difficult and damaging to one's life as well. So benzodiazepines, addiction, very big side effect of those medications. Moving to antidepressants, there are several classes of antidepressant. The first one on the scene was the MAOIs, or the monoamine oxidase inhibitors. And they are the oldest class, and they're fairly effective. They work on all of the catecholamines, so serotonin, norepinephrine, and they also work a bit on dopamine. And they're great, but they're not as effective as the newer medications. But their big downside is that they interact with tyramine in the body, and they can cause death if they interact with too much tyramine. And you get a lot of your tyramine from your diet. And so people that are taking monoamines oxidase inhibitors have to follow a specific diet. You find a lot of tyramine in cured goods like meats, like deli meats, in cheeses, and things like that are pickled, for example. You have to be very careful how you, like, for example, with leftovers, with things that may have started to produce bacteria and started to basically started to go off. You have to be very careful. You have to be careful to keep all of your meat, eggs, fish in the fridge so that they don't start to ferment and produce tyramine. So basically anything fermented can have too much tyramine in it and interact with the monoamines oxidase inhibitors and produce a reaction in your body that can cause coma or death. Definitely not something we want to see. It causes like a hypertensive reaction. Your blood pressure will go up and you can die. In terms of the tricyclic antidepressants, it's a lot easier to overdose on them, but they don't have as many scary side effects. But the newest medications, SSRIs or SNRIs, which is like the Prozac, citalopram, those kinds of medications. One of the ones that you see often, especially on those, like the black box warning, is that specifically in younger people and older people, there is possibly an increased risk of suicidal ideation and suicidal action. So we've seen kind of a bit of a epidemic, I guess, of young people particularly, but also older people. When they start taking an SSRI, they can have paradoxically this increase in suicidal ideation. Sometimes in people where there was none to begin with, they can start having suicidal ideation. We're not sure what the mechanism for that is, but it is a real occurrence. But the other thing that comes up, and it's not as well publicized, I guess, is serotonin syndrome. Now, there are a lot of medications that raise serotonin in the body. And that's because serotonin is not only a neurotransmitter that deals with depression and anxiety, but it also, it acts widely in the brain, in the gut, in the body in general. It has some effect in migraines. It has some effect on nausea. It has some effect on a variety of things. And so medications as disparate as migraine medications, which I take, things like Gravol, or if you're in the States, Demerol, things like other psychiatric medications, so lithium, for example, or antipsychotic medications. All of these things can raise the levels of serotonin in the body. Even some herbal supplements can raise the levels of serotonin. St. John's wort is a good example. Taking tryptophan is a really good example as well. So if you're taking enough of these things that are raising levels of serotonin in your body, you can get to like a critical point where you get too much serotonin and your body goes toxic on the serotonin, and that's called serotonin syndrome. And it can be as mild as having some diarrhea, stomach upset, that kind of thing, to having a very high fever, shivers, shakes, to like actually having muscle rigidity and your body not being able to move properly, to catatonia. I mean, like it can run the gamut from very mild to life-threateningly severe. So serotonin syndrome, one to watch out for, particularly if you take a variety of medications and don't know what each of them do specifically with regards to serotonin. That's something to make sure that you talk to your doctor about if you take different medications. And I will warn you, Migraine medications are one of the prime culprits, because a lot of people that struggle with depression and with bipolar disorder also struggle with migraine. And if you take too many migraine medications at the same time as you're taking antidepressants, at the same time as you're maybe taking lithium, at the same time as you're maybe taking Gravol for the nausea that comes with the migraines, et cetera, et cetera, et cetera, it can get up there pretty quick. So the next class of medications that I'm thinking of are the antipsychotics. So this one would be commonly Seroquel, for example, or aripiprazole, or Latuda, which is a newer one that I'm on right now. And these medications, they commonly cause their effects of like antipsychosis partly by calming a person down. So they're quite sedating, quite honestly. But the dangerous effects really come in their effects on dopamine. So there's the whole dopamine hypothesis of psychosis, where there seems to be an imbalance in the amount of dopamine in the brain, and that's related to the paranoid thoughts and delusions, as well as hallucinations, and that if you play with basically the amount of dopamine that's in the brain, that will affect the psychotic symptoms. And so these medications are in an attempt to do that. But dopamine also plays a really key role in movement. And so Parkinson's disorder is also a disease of dopamine in the brain. And Parkinson's disease is a movement disorder. It's actually a progressive dementia that affects movement in the body. And so it shouldn't be that big of a surprise that both disorders, which are affected by and affect dopamine in the brain, can have some similar symptoms, and that their medications might have similar side effects. So, side note, actually last summer I was given what's usually used as a Parkinson's drug to try to affect my own bipolar disorder, which is related to psychosis. It didn't work, but it caused Parkinson's-like symptoms in me, so I ended up with my head like this. I was really unable to keep my head straight. That kind of bending over is one of the symptoms of Parkinson's. And so I got to see firsthand how manipulating dopamine in my brain caused Parkinson's-like symptoms in my body. Fortunately for me, that was reversible. When the drug was removed, it took time for it to come out of my body, but eventually it did, and my posture was regained. But for these side effects that come from antipsychotic medications, sometimes these side effects are non-reversible, and that's what makes them so distressing and so dangerous. Now, these are more pronounced for the first generation or older antipsychotics, so the ones that were made basically before the 1990s. The second generation antipsychotics came in the 1990s, and they have lesser effects on this system, but it's not gone. It can still happen. So the two side effects that I'm thinking of are tardive dyskinesia and extrapyramidal symptoms. They're both movement disorders, so they're both, they're not the same, but they both affect movement. With extrapyramidal symptoms, you're expecting shuffling gait, you're expecting difficulty in initiating movement, sometimes shaking. With tardive dyskinesia, this is where you get repetitive movements. Quite often it's movements of the tongue and the mouth. And so for people with specifically schizophrenia or other psychotic disorders, if they get this side effect, and it's usually not reversible. So they get this side effect, and if you don't catch it early enough, like, it can be quite pronounced. And I wouldn't care to mimic what it looks like. But if you Google it, you can see it. It's quite pronounced. A rolling of the tongue, a bulging of the cheeks, sometimes in kind of a rhythmic fashion where there's like a almost tick-like appearance to it. And this can really mark a person for life. And so even if they're not experiencing psychotic symptoms, if they have this tardive dyskinesia, you can see it right on their face that there's quote unquote something wrong with them. And so for those folks that then come out of a psychotic episode and they're trying to find work, or they're trying to make relationships, having this kind of a right on their face, this kind of movement disorder can be very, very distressing and very disabling and debilitating. And as I say, it is non-reversible for both tardive dyskinesia and extrapyramidal symptoms. They both seem to be that when you take the medication away, they don't go away. Not quite sure why, but they don't. And trying another medication, even of the same, like a different medication in kind of the same class, can make it worse. And so a person can end up having to decide whether they would rather have psychotic symptoms like hallucinations and delusions, or whether they would rather have movement disorder that can be very disfiguring and disabling. So the hope with this video is not to remove hope from people that are struggling with already very serious and very destructive diseases, right? So we've talked about anxiety, depression, which also goes along with bipolar mood disorders in general. We've talked about psychosis, like all of these different kinds of disease. This basically covers the gamut. I can even mention like lithium and other mood stabilizers. Lamotrigine is a mood stabilizer. Lithium there can be lithium toxicity. I've talked about that on my channel before, which can lead to death very quickly. Lithium also tends to damage the kidneys, and that can be irreversible as well. So all of these medications basically cover the gamut of the medications that we would prescribe for psychiatric disorders. The news isn't great, right? Insofar as if you're struggling with a psychiatric disorder, which do you prefer? To have the risk of one of these serious outcomes, or to have the risk of the serious outcome of the psychiatric illness that you're struggling with? Ultimately, it's a numbers game. So the risk of any of these very, very serious outcomes happening is low, right? So there's always a risk-benefit analysis. They can't be giving out drugs that are extremely likely to cause these very serious and long-term effects. You also need to be able to talk to your doctor about what your risks are, that's specifically your risks. So for me, having bipolar disorder and migraines, my risks are different of serotonin syndrome, for example, than they are for other people that don't struggle with migraines. So being able to talk to my doctor about what my particular risks are is really important in me making an informed decision about what kinds of medications I'm willing to try and what kinds I am not willing to try. It's also a matter of like increasingly the knowledge around these side effects is getting better. Most often catching these things early can get you a quick relief from these side effects. If you catch any of them early enough, usually you can get away without long-term effects, even tardive dyskinesia, even extrapyramidal symptoms, if you catch them like right away. And we're getting better at catching them right away because there's more education out there and more discussion. So if you're ever prescribed a medication by your healthcare provider, you need to ask, what are the side effects I should be looking for? What are the most dangerous side effects, and what are the symptoms of those? When do I wait and call you, or when do I go straight to the emergency room? If you don't have access to a doctor that you can talk to about that, or if a lot of people say that, well, my doctor only has like 10 minutes with me and it's not long enough and I don't have time to ask all my questions. Pharmacists are great for that too. They have all that kind of knowledge as well. So talk to your pharmacist as well. The internet is a great tool. Yes, it will tell everybody that they have cancer and are going to die. I mean, that's what Dr. Google does, right? But looking up things like there are apps and there are online tools that you can use to track all of your medications that I would actually highly recommend doing, so you can keep a record of all your medications. And they will check interactions for you. So mine will tell me that I'm at risk of serotonin syndrome, for example. If you're on for example, an MAOI or monoamine oxidase inhibitor, it will put a flag up and tell you you're not supposed to be eating fermented foods, kimchi, any like salamis, things like that. It will tell you. So those things are really helpful tools. Become an informed consumer. No medication is without risk, right? Tylenol or acetaminophen, it can damage your liver and cause permanent liver impairment resulting in either a liver transplant or death. It can. It does. For a very small amount of people. So you just have to be informed. We all pop acetaminophen like it's candy, right? So we just have to become informed consumers. Having videos like this that talk about these potentially really damaging side effects allows us to know and to be able to share with other people the knowledge that we have, and so that we can all be looking out for ourselves and for one another. When we start a new medication, knowing those risks can be really empowering, and actually, instead of making you feel like, you know, everything's so dangerous and there's just no hope, it can actually make you feel like you got this, you can do this, and you can. I have been on so many medications in my time, and sometimes it's scary. It absolutely is. Starting lamotrigine, this has been frightening. I've been doing the daily mirror check for any mysterious rashes, and yeah, I mean, it can be frightening sometimes. But if the benefits of the medication outweigh the risks, then you're doing the right thing. So having those conversations with your doctor, family and friends, being aware of the outcomes and the side effects and what to look for, that's where your power lies. So I hope this has helped someone. I hope that you never find yourself in the situation where these terrible side effects are going to affect you. But if you do, I hope that this helps you to get control over it and to know when to go and get help. And I will see you in my next one. Take care of yourselves this week. Bye.
Stigma Crusher.